always one of our favorite things to get an expert on here to tell us a little bit about what might be going on with some injuries across the Titans in the world of sports. So, Austin Stanley, Zach Bingham of A to Z Sports here, joined by Dave Kimfort from the Bone and Joint Institute, physical therapist. We're going to talk a lot about the hamstring injuries, not necessarily specifically with AJ and Julio, obviously, but just kind of what the Titans wide receiver duo might be dealing with hamstring injuries as AJ Brown returned to practice in a limited form on Wednesday. We're still awaiting to see what happened on Thursday at practice, that being today. But glad to have Dave along with us. He's always been great whenever we've had Dave on these DocTalk segments presented by the Bone and Joint Institute, boneandjointtn.org, the region's destination for comprehensive orthopedic and sports medicine care. Whenever you get hurt, you go to Bone and Joint Institute. They'll take care of you. They streamline the process. They do everything from start to finish through the rehab of the injury and recovery as well. So, Dave, thanks for jumping on today. Appreciate it.
Yeah, thanks. Good to see you, Austin. Appreciate that. Hey, Zach. Good to see you.
Hey, Dave. Well, I'm going to start with look, I've done a little research, Dave. All right. And the research that I have done tells me that there are 3 muscles that make up the hamstring. Is that correct?
You're a well-educated man.
Oh, see? Off to a hot start here on Doc.
A quick Google.
Don't steal my thunder now, Zach. Don't steal my thunder.
Right. Well, so I'll ask you this. Can you take us through those 3 muscles, and is one more likely to get injured? And again, we don't know enough about AJ Brown and Julio Jones's hamstring injury, but as from what you've seen with athletic injury and the rehabilitation process, is there one muscle of the hamstring that is more likely to get injured? What injuries have you seen to hamstrings for the majority of the time?
You'll see a mix. And so just for everybody out there too, so that we kind of think of when we talk about the hamstring, we talk about the hamstring like it's one thing. So it is 3 muscles, like Zach said. There's the semitendinosus, semimembranosus, and biceps femoris. Okay. So 2 are on the kind of inside of your thigh. One's on the kind of on the outside of your thigh, but all kind of posterior in the back. It's a 2-joint muscle, meaning it actually crosses your hip joint as well as your knee joint. Okay. And so the active collection of those muscles working together is to extend the hip or put it behind you and then to flex the knee and bend the knee. So you'll see injuries throughout the range of the muscle. You'll see it on the inside muscles, the outside muscles, depending on kind of the mechanism of the injury. The injury really, it's really important where the injury occurs too, because a lot of times you'll see most of the injuries in the hamstring will happen kind of in that top third of the muscle. Okay. If it happens a little bit more where the muscle meets the tendon, that's kind of common too. A mid-muscle injury is good in a lot of ways, if you can call any injury good, because there is more blood supply there. Sometimes if you get more of a tendinous injury, there's not as much blood supply. The blood supply is nutrients and healing. So sometimes they're a little bit more delayed to heal if they're torn a little bit more near the tendinous attachments, either kind of at just below your buttock or at the back of the knee, or it attaches to the lower leg. The worst case scenario sometimes are you can actually have such a strong contraction where it attaches to the bone, you can actually get what's called an avulsion fracture. And so they'll call it a hamstring injury, but it actually is the hamstring tendon pulled so strongly on the bone that it pulled a piece of bone off. And sometimes they can heal. You just immobilize them and they heal and they kind of tack back down. Other times it's actually a surgical procedure to go reattach the hamstring. So that's when they get really nasty.
It's interesting. Now, Dom has a question on Facebook, and it's about AJ Brown specifically, because we've known that AJ had knee surgery on each knee in the offseason and was recovering through that. Looked pretty good, but is there any what type of situations could a hamstring injury be related to some type of knee surgery or recovery on that end?
Yeah, no, that's a fantastic question. And it's kind of interesting because even in other sports, you'll see it. You could have a baseball pitcher hurt his knee. He rehabs his knee, but then all of a sudden he injures his shoulder, right? And you're like, well, wow, this guy's just this injury-prone guy, or these things have happened. But a lot of times, you have to be careful with when one injury happens, you can get so focused on one thing. And I know in the NFL they've been doing all this with him. I'm sure that this is not his case, but you really have to look at the joints above and below. If a pitcher has a knee injury, you got to look at what's going on with his trunk and his core stabilization and his shoulder strength and all those things during that time. And it's the same thing if you have a previous knee injury. The lucky thing is with the knee injury, I'm guarantee you they were hitting his hamstrings and his quads and the hip muscles and all that. But one thing can contribute. So if you're still a little bit deficient in one area, sometimes there's just an imbalance. And this is one of a really common cause of hamstring injuries is you can become so dominant in one side of the muscle, like your quad in the front of your thigh, for example, that can start to overpower and sometimes create injuries in the hamstring, even if you're still a strong guy and you test well. So really muscle imbalances can cause some of that. And it just depends on how somebody's recovered, if they fully recovered or not.
Is the hamstring overall, I feel like, and we've covered the team for a long time, and football players and wide receivers, usually that those are the type of players that get these hamstring injuries. Is this one of the hardest muscle injuries to recover from? Does it take some of the longest time? Because I feel like, the saying of being hamstrung for a period of time, I feel like that is the case. But from your experience, is that what you've seen?
It is. And back when I used to play with the Jaguars, if everybody remembers Fred Taylor from back in the day, he was plagued with hamstring injuries. And it was a very, very frustrating thing. And hamstrings, I think, in general, are one of the most frustrating injuries because you're like, gosh, it's just a muscle injury. But because of the forces that are generated throughout the hamstring, especially with sports that require what football does, the power production and the speed and the sprinting, the deceleration, all those things, it is definitely one of the most common things you see and very frustrating. One of the things that the most common way to injure your hamstring is with an eccentric contraction. So if you were to shorten a muscle, that's concentric. If you're lengthening a muscle, that's eccentric. Okay. And so the way it actually gets injured is when you're producing a force through a muscle that's shortening, which seems kind of contradictory a little bit, but it happens at the hamstring all the time because as you're driving off of your back leg to sprint, for example, you're extending your hip, but you're also producing power and shortening the muscle at the same time. So a lot of times that's when you're going to see most of your injuries is with that force production or that eccentric contraction through the muscle. But yeah, you're right. It's a frustrating one. I think one of the things that's really important as far as the healing timelines for hamstrings, and we think about it in rehab all the time, is early immobilization and those types of things, because you want scar tissue to form. And I think one of the things that we see sometimes in sports, and I mean, I've probably done it with my own kid at times where you're like, oh, he's better, he feels better, he's out of pain, and then you try to push him back a little bit, but you can't push these back too early in some ways. With certain types of activity, you can usually get pretty active and keep up a lot of strength and flexibility throughout your hip and your leg, but you actually want scar tissue to form initially because that's what's going to heal the fiber separation, basically, of the muscle fibers. Okay, but then you want early mobilization, pain-free mobilization, and really strengthen around the hip and around the core and those things, all these muscles that support the leg, while allowing the hamstring to still heal. I got great advice from Mike Ryan, who was actually the athletic trainer down at the Jaguars when I was there. And he's a very well-known name in the NFL and in rehab in general. And he would always talk about, when you get that first tweak and guys want to stretch it, or they're like, oh, I feel tight. And sometimes stretching early on, especially in the first 48 to 72 hours after an injury, is one of the worst things you can do. It's one of the first things we all want to do is to, I feel tight, I want to stretch it out. But there's actually the mechanics of the injury combined with the increased blood flow and the chemical reactions that are going on, you can actually increase more bleeding and increase your healing timelines. So sometimes, you want to get back right away, but just leaving that thing alone and not even trying to stretch it for the first 72 hours. Mike Ryan, again, that trainer, he talks about that's one of the most important things he tells guys. If you pull your hamstring, you leave it alone and you strengthen around it, but you don't touch it for a while. Allow that scar tissue to form. Your body's pretty amazing. It knows what to do. You just got to make sure you don't get in the process and get involved in the process too much and limit your body from its natural healing.
No, that's really interesting. I've never heard it put that way before. A to Z Sports DocTalk segment here presented by the Bone and Joint Institute. Physical therapist Dave Kimfort with us here, former NFL offensive lineman with the Jags. Not holding that against him this week in particular, for sure, for Titans fans watching this. But talking a little bit about AJ and Julio, who had these hamstring injuries. So we're gonna watch the tape here, Dave. So we have some video that one of our Titans reporters, Luke Warsham, put together of AJ practicing yesterday, going through simple wide receiver individual drills, some ladder drills. And we were talking about this on our morning show earlier about, is this testing his hamstring, or are these drills not really putting much on his hamstring? So I'll play this video and we can talk over it. As you see AJ just getting warmed up here. And then he starts doing some other ladder drills and working on catching, but these obviously not very explosive, but these next ladder drills, very curious to see your thoughts on how much he actually is testing his hamstring, because he looks good doing these ladder drills, as you see here. Obviously, a little explosion out of that break there, and then he'll break the other direction too. But he looks great, right? He looks healthy doing this. But are these drills that you can look at him watching him do this to tell anything about the hamstring recovery?
Well, the good thing for me right off the bat, and again, it's hard to say just from watching that, but the good thing for me is a lot of times you grade a hamstring strain like you would an ankle sprain. So if you ever heard like grade 1, 2, or 3, so if you have a higher grade sprain or strain, excuse me, of a muscle, you're not going to be doing a lot of those linear things right off the bat. So right off the bat, I look at it and say, gosh, if he's doing that pain free and he's doing linear activity, which is what the hamstring does, that push pull, that's a good sign right off the bat that they have him doing that. Because a lot of times in rehab, we don't even, if it's a worse kind of injury, we don't even start on anything linear that'll strain the hamstring that much because there's not a ton of force production in a ladder, but the deceleration drill he was doing with the rope around him and those type of things, there's some force production. He's pushing off against the resistance of not only his body against the ground, but also against the resistance cord. So right off the bat, that makes a fan smile and say, okay, he's doing better than we might have thought originally. A lot of times I was going to say is if somebody has a higher grade injury, we just start with lateral stuff. So we can still keep them mobile. We can still strengthen the hip, keep working on their agility, keep working on speed. But we don't push the linear straight line kind of front running stuff for a while. So it does make me encouraged that he's hopefully on a very good healing path at this point.
Yeah, I'd be curious to see, if he'll get back to 100% of his hamstring, right? Because this is an in-season injury. We're in the first quarter of the year. There's a lot of football left to be played. When you see things like this, and it's hard to speculate, but will that hamstring, the probability of it getting back to a full 100%, after several weeks of using it on, you're playing in the NFL, you're using it at an all-time high. Is there a probability that it won't be 100% the rest of the year, or will you have to? What kind of percentage could you kind of project possibly that it could get to? And not knowing the injury is the toughest part because we don't know that grade, right?
Right. I think that's the tough part. It's hard to answer that kind of a question. However, it's a great thing that's on everybody's mind is how much can we get back. So I think with lower grade things, absolutely you can go back. I mean, people have low grade hamstring strains and go back and they'll never have another problem that year. A lot of times, and the way to think about it, guys, is when you have a lower grade strain, you're separating muscle fibers. Okay, scar tissue comes in. It's almost like it lays itself down in the muscle to reattach and kind of help the healing process, but it doesn't really know how to do it. And so it's kind of like throwing toothpicks on the floor. Okay, it's kind of scattered within the muscle. And then stretching, massage, heat, actively using that muscle, concentrically shortening and eccentrically lengthening, those fibers start to realign. So if you think about a rope, if you want a strong rope, you want all those fibers aligned in the direction of the pull. Okay. So if you do have some of that kind of intermixed, weaker kind of areas of the muscle still, when that gets pulled on, the only ones that are going to help you are the ones that are aligned right. The other ones, okay, are going to be weaker and can potentially re-tear, right? And so that's the thing is it's not just, gosh, I feel good and my pain is gone and I can jog and I can do those things. It's how are they going to respond during those high level, high velocity motions. So if the muscle has had time to heal and they've been doing all the things, so I guarantee you they have those guys doing with heat, massage, lasers, ultrasounds, all these things that increase blood flow, increase our chance of healing, getting the good nutrients to the tear, and then gradually working into the right types of strengthening and stretching. A lot of times you'll do very, very well. And you have the best chance of that muscle fiber alignment being the strong enough and powerful enough to handle the loads of what he's going to need to do the rest of the year.
How do you know if it's ready to go fully without an athlete trying to get a full extension sprint going with a hamstring? Like, can you tell some things before that, or do you really have to test it?
It's a gradual test, and that's the thing is you try telling an athlete to do anything gradually, right? And right. You try telling the coach like, hey, it's going to be, so those are the tough things in the NFL that and any athlete deals with. I don't care what level you're at, whether you're just a weekend warrior or an NFL guy. But that's why you have to go through the steps. And a lot of times when people are coming in with us, we'll test a little something. We'll say, hey, if that's, if your bruising is minimal or gone, you're not tenured, we don't feel any deviation in the muscle, and we'll start certain activities. And then it's just a gradual progression from those lateral drills. If you can do that pain-free and do some explosive lateral stuff, then we start on some gentle linear things. And then the linear things go well, then we start picking up the pace. And then you work your way. We'll do like build-up sprints. So you start at a jog, and then you build up like a 50% sprint, and then you test it. And you see, hey, no worse bruising, no worse pain. He didn't set himself back at all. We can still do everything we were doing this morning, even after doing that. Then the next day you can ramp it up a little bit. So you can do that in a stepwise progression. I think the tough thing where we see a lot of re-injuries is guys say they're pain-free. They go through certain drills, and all of a sudden they do their first explosive move when they really haven't trained that eccentric contraction to test it. And then that's when you get the unwelcome surprise of it's not where it should be yet.
So and I thought that was good because that is, you kind of described of what you have to do to get it warmed up. let's say he goes, let's say the next game he plays,
Mhm.
he plays and he gets through it. What does he have to do immediately after that? Is that just going straight to ice? What is the next couple of days for the maintenance of maybe the following week to get ready for the second game that he plays?
Yeah, it really depends on how you felt afterwards, right? So you'll see guys sometimes they'll pull up a little bit or whatever, and you have to respect the quote tweak, right? A lot of guys like, I just tweaked it. Tweak's a sign. That's your body trying to tell you something. So depending upon if he has those types of symptoms during the game, that's when, you know, the athletic training team and the PT team for them, I'm sure, is looking into it and saying, gosh, maybe we need to shut down earlier in the week, recover, recoup, do a lot of therapy and those type of things, and then kind of start progressing back midweek or late week, those type of things. If he gets through it, does really well, and next morning he feels fine, and it's not going to be the dramatic signs, I'm sure, of an original tear, you know, bruising and those type of things you'll see with the really bad stuff. But you still have to respect the symptoms the next day. And every day is a little bit of a recheck, you know. I mean, every play can be a recheck sometimes, because you can't always guarantee. There's nothing more unpredictable than the NFL sometimes, as far as activity levels and what you're required to do, and when things are unpredictable and you get the adrenaline boost and all that. So it's tough. So you really have to just go day by day, monitoring symptoms, continue to do rehab, increase the rate of healing as much as you can through those things we talked about. Definitely after activity, with any active, you know, like we talked about, the bleeding is your body trying to heal itself, but it can be a negative too. So controlling swelling, a lot of times compression afterwards to keep excessive swelling out of that injury area is used a lot. So compression and ice is a big thing post activity for sure.
No,
Excellent.
yeah, that's awesome. Good information. So linear good, right?
Linear good. We like seeing linear out of them already. That's great.
That's
Yeah.
great. So we'll see what happens. You know, Titans practice ends a little bit later this afternoon. So we'll see if those practice videos come out. If AJ is in fact out there doing a little bit something, we'll see what Julio might do as well. But Dave, appreciate it a bunch. You're always great whenever you jump on DocTalk. So the people know that they're in good hands when they go to the Bone and Joint Institute for whatever it might be, surgery or rehab, that they've got you guys covered over there. So Dave, appreciate it again, and good to see you.
Great. Thanks, guys. Thanks, Austin. Thanks, Zach. Good to see you guys.
Dave.